Hi, my name is Jody and I am one of the nurses at the Community Health Clinic. My primary role at the clinic is the newborn screen follow-up coordinator. I'm going to tell you a little bit about newborn screening today. Since my time in the clinic, I have found that most parents do not even know what the newborn screening consists of or what that means for their new baby. So let's talk about it for a minute. There are three parts to the newborn screening. So there is the hearing screen, there's the pulse oximetry screen, and there's the blood spot collection. So the hearing screen, that's done usually right before you go home. It is a very painless test that's done when your baby's sleeping. They put some little stickers on the baby's head, or they put a probe in the baby's ear to assess for any early congenital hearing loss. The purpose of this test is to see if there is any early hearing loss, which if it's detected early enough, intervention can be done through hearing devices if needed to help with early language skills. The pulse oximetry test is a test that, again, is very painless, and it's done usually right before your baby goes home from the hospital or birthing center. That test is essentially just a probe that they put on the baby's hand. It's a sensor, and one on their foot, and it measures the level of oxygen in their blood. So this screening is checking for critical congenital heart defects that would have not already been detected. The purpose of this test is to see if the baby could have a heart defect that hasn't been detected and get some early intervention and repair if needed. So usually if your baby would fail that test, the pulse oximetry kind of challenge, they would get referred to a cardiologist for a further workup. And then the last piece, and this one is kind of my special piece, is the blood spot collection. So this is the part where they come in, they poke your baby's heel, they collect drops of blood onto a filter paper, which is then sent to the state newborn screening lab. At the lab, then the blood is screened through a high-tech, intricate process that looks for over 50 rare conditions, many that are time sensitive. Without treatment, some of these conditions could cause serious health problems and even death. There is a whole team of physicians, scientists, public health lab workers, nurses, advocates working behind the scenes to make newborn screening possible and for the best start for your baby. These people have paved the way for newborn screening to be possible and detect potentially life-threatening conditions for your newborn. For almost 60 years, newborn screening has been in place to save babies' lives, and it continues to improve and add new conditions to it each and every year. Many people still call this test the Pku test. And let's talk about why it's called the Pku test, or why it began to be called the Pku test. So Dr. Robert Guthrie developed the filter paper during his work with Pku back in the 1960s. From 1962 to 1964, he developed a research project in which he enrolled over 400,000 newborns in a 29-state pilot that looked and screened for potential Pku in newborns. This proved so successful that many states instituted newborn screening immediately. In 1965, states started mandating that every newborn be screened for Pku, hence why it was called the Pku test. Well, today, newborn screening is much, much more than just a Pku test. The state of Indiana screens for over 50 conditions. Here at the Community Health Clinic, we are a designated site for follow-up care for any newborn that has an inborn error of metabolism or an abnormal screen for an inborn error of metabolism, and we cover the northeast part of the state. We're covering 12 counties. And we additionally provide care for abnormal screens for severe combined immunodeficiency and spinal muscular atrophy for the same 12 counties, plus an additional 6 counties in southern Indiana that have a large plain population. The clinic provides metabolic care, including nutrition monitoring, in-hospital management, and long-term follow-up with our team. We serve as a medical home for many of these families. It is our goal that every infant in the state of Indiana receive a newborn screen at 24 hours of life. This gives each baby the best outcome should he or she be affected with a condition detected on the Indiana newborn screen. That's just my little speech on newborn screen. I hope you enjoyed it and learned something, and I hope you enjoyed my doggos in the back. We're all working at home. Thank you.